in here have had a major injury where they couldn't perform. Yeah, I've had a lot too. It's pretty painful. But today I want to introduce you to the whereabouts of Tommy John surgery. Tommy John surgery is a pitcher's worst nightmare. And over 150 professional baseball players have had this surgery. What is Tommy John surgery? Tommy John surgery is a ulnar collateral ligament reconstruction, or known as UCLR. It is a procedure that is done to repair a damaged ligament in the elbow. This injury typically makes the elbow feel unstable and requires physical therapy. If the injury doesn't respond to the physical therapy, surgery is typically the next treatment. Ulnar collateral ligament issues are common in serious throwing athletes such as baseball players. Throwing activities place unusual levels of stress on the elbow, making the injury to the area more likely than other sports. For many athletes, Tommy John surgery can restore full function, and for some, a complete recovery is possible. For some patients, the surgery is performed to allow them to continue to. For some patients, the surgery isn't performed to allow them to continue to perform as an athlete, but to alleviate the symptoms of the injury, mostly elbow pain and numbness in the affected arm. Why is it called Tommy John surgery? Tommy John was a professional pitcher for the Los Angeles Dodgers. In 1974, he damaged his ulnar collateral ligament, which is considered to be a career-ending injury for a professional pitcher. However, Tommy John was elected to have a procedure that was an experiment at the time, replacing the injured ligament with a tendon from his other arm. With low expectations he would ever be able to pitch again, Tommy John consisted to have Dr. Frank Jobe perform the procedure. Then he took the rest of the 1974 and 1975 baseball season to rehabilitate his arm. The end result was really good. Tommy John pitched in the bigs until 1989, and the procedure is now commonly known as Tommy John surgery, named after him. The recovery after Tommy John surgery takes a while, sometimes up to a year or 2 years, depending on the person. After the surgery for this type of injury is straightforward. It typically requires an overnight stay in the hospital, followed by a long period of time of rehab. For the first week, the elbow may be in an immobilizer, which supports the elbow where it can't bend or move or anything. It has to be levitated pretty much. Keeps the elbow supported and held in place. After surgery, many athletes feel that they are stronger than before. And they sometimes even throw in harder. Depends on the person again. Sometimes even throw in slower, or they can't pitch anymore. The vast majority make a complete recovery and are able to return to their normal activities. Some people can't even throw or even lift up their arm after Tommy John surgery. Pitchers, this is the number one thing that they hope that doesn't happen to them. If it does, then they're out and they don't know if they can even come back until maybe a year after rehab, when they hope they can throw again. Sometimes the procedure takes about up to like 12 hours to do in just one. Maybe sometimes it takes 2 sets just to fix it up. Sometimes they take the ligament from the other arm, or they take it from your leg, your knee, or whatever, and they try to fix it up so you can pitch again. So hopefully after today, you guys have soaked in the knowledge about Tommy John surgery. Thank you for your time.
I was a little confused, like how you start off, like Tommy John, if you're going to talk about a person or what's going on, I would probably explain what it was first, opposed to like talking about it first, because I wasn't sure still like what you were talking about. I obviously got it with the picture, which was kind of like hurt my back, but yeah, simply being a lot about the topic. Probably try to relate it to us since we're not pitchers. And then, yeah, you guys just sounded pretty confident since you are a pitcher. And you could, like, maybe, I feel, talked about, like why is it their worst? Because you said, oh, was their worst nightmare? And it's like, okay, like, is your arm done for the rest of the period of time that you're going to be, like, you can't be a pitcher anymore, or are you able to recover from it? So yeah, just be, like, more clear. Other than that, like, yeah, you had a lot of information, and it does seem like a drag if it were to happen. Hopefully it never happens. Oh, and how? How can you get it? I was like, okay, why is it a worse nightmare? Like, what happened? Yeah.
All right. Well, I think the context of Dre's comments are probably very close to some of the things that I'm going to say. It feels to me like the speech is almost inside out. You've got a section in the middle of the speech that kind of explains the background on it, and I'm wondering, why is that the middle of the speech? Why isn't it the beginning? In fact, it should probably be your attention device instead of this kind of audience survey sort of thing. Start off with the story about Tommy John. You know, Tommy John is a name that some of you may not know. Some of you may be very familiar with him. But what he's most noted for is the fact that in 1974, at the height of his career, he had this injury. And at that time, people thought, that's a career ender. He's done. All right, but he underwent an experimental surgery that attempted to fix the particular problem that he had. Today, I want to tell you what that problem is that is especially susceptible to pitchers, you know, what it is they do to try and fix it, and whether or not it's going to make a difference in whether or not rehabilitation is going to have a positive impact. All right, so let's talk about the injury itself. You need to give it a structure. You've got information here, but it doesn't feel like there's any plan as to how it's going to develop. I think starting with the story and giving us the historical context would be a good introduction, and then you can kind of explain what the injury entails. And then you can talk about the injury. Basically, here's what happens in the body, and show us those kind of components. I got to be honest with you, you put that picture up, you never made a reference to it. I have no idea what it was I was looking at, and it's in the background the whole time. I don't think it helped you at all. It doesn't really add anything to the presentation. Now, I think you did do a nice job kind of explaining what the injury is and talking about what the procedure is and a little bit about the context, like I said, but the context all seemed like it was buried in the middle instead of at the beginning that would have led us into this a little bit more effectively. And you can also point out that it's especially important for pitchers because this is the kind of injury. But do other people get this kind of surgery? Is it something that is beneficial for another reason other than trying to throw a baseball professionally? There are probably other kinds of injuries or other kinds of people that get that injury that need it. I don't know if anybody, the average person ever injures their elbow in that way and needs this kind of surgery. So maybe it is really limited. Well, tell us that, that this is in fact usually restricted to this particular group of people. But then also tell us why that's pretty important. Look, baseball is, pitching. Pitching is one of the key issues in baseball. It's a big industry. People have careers. Tommy John was a phenomenal pitcher whose career was going to end because of this injury, but he came back, like you said, and he pitched for 13 more years after he came back and was very successful. And talk about those kinds of things. And imagine if that happened to the greatest players in any sport. It's and you can also kind of use it as an introduction to other kinds of things too. Sports injuries come along. Innovative work has to be done. Here's an example of an innovative work that saved somebody's career, expended the pleasure of all the fans, and made the game better as a consequence. These kinds of things happen in other kinds of injuries too, where they make these phenomenal changes. But today I want to focus on this particular one, and then maybe it's a little bit more universal for the audience, and we can